Hello there, my name is Kevin Durjun. I'm working with the TCM Academy on a series of short films to help to shine a light on some of the great work currently taking place in the world of acupuncture and TCM. Today, I'm delighted to meet Dr. Hamid Montakab.
Kevin, how are you?
Brilliant, brilliant, thank you. Now, I'd like us to focus today on motivation. You've been a practitioner for many, many years. How do you stay motivated?
Um, that's easy. Actually, it's very easy. For me, Chinese medicine has been a way of life. Therefore, I have been growing with it and through it. So the motivation is natural, and I think I will keep learning and studying it until my last breath. So the motivation is has never been an issue.
Do you have any advice for students who are deciding to embark upon a wonderful career in TCM?
Um, I would say the most important advice or advice I could give is to consider Chinese medicine as it should be. That means a holistic medicine. I remind that I come from a background of Western medicine where we have learned to treat disease. We are not concerned with the person. We are concerned with the diagnosis and the disease, whereas a holistic medicine is primarily concerned with the person. What I see around the world happening, unfortunately, is that modern acupuncture, right, or called TCM, wrongly called TCM, which is traditional Chinese medicine, which actually the name was coined in the early 50s. So it's not even 100 years old. And modern TCM has been modeling itself on Western allopathic models of medicine, diagnosis, a disease, and treatment of this disease. And this obviously in acupuncture and especially in herbal medicine. The person has been disregarded. And this is something that ancient Chinese medicine, what we call classical Chinese medicine, has always reinforced and underlined that actually the spirit of the person is the most important element in not only in disease, but also in considering the treatment strategy. So the advice I would give the student is to recall that this Chinese medicine has its roots in the classics, and the classics have put the human being in the center, considering the human being in the center, what Western medicine unfortunately has forgotten.
Hamid, could you describe how you built your practice up?
I did it in a sense accidentally, but this is also an advice I would give the beginners is to start by specializing. Now, a tendency for students who embark on Chinese medicine is to offer treatments for every possible pathology. And obviously, they are lacking the sort of the experience and the confidence in treating complex diseases. So specialize. That means learn everything there is about one pathology and let it be known. For example, you're specializing in sleep problems, you're specializing in headaches, in allergies, gynecology, obstetrics, etc., etc. You also, it gives the confidence when you see that you are performant. The advice is not to start with treating every possible disease. In allopathic medicine, obviously, it's the opposite. You do general medicine and then you go and specialize in one particular area. In Chinese medicine, I would advise to do the opposite.
Now, being a practitioner can often be quite a lonely business. It can be me and my patient day in, day out, day in, day out. How do you deal with this?
Well, to tell you frankly, I have been fortunate that most of my career I have worked in a group practice. And I find it very challenging. During a certain period, I was doing both Western allopathic and Chinese medicine together. So we had a big group of doctors, and I found it very interesting to approach allopathic medicine with Chinese concepts. It was also, I would say, valuable for me to verify a lot of the theories and also bringing another perspective to the allopathic doctors with whom we were working. Later, I was fortunate to share my practice with my wife Solange, and I find that working with practitioners from different backgrounds is very enriching and brings a different view, a different perspective, and also it's also very fruitful for the patients because cases can be discussed, specific cases, and new ideas can be tried out. So I advise, even if the possibility is lacking, to have a group practice, to organize with your previous co-students with whom you have studied, to have a regular continuous exchange.
Hamid, how would you recommend that practitioners of at all stages in their practice, how would you recommend that they develop their confidence?
Well, I think the first aspect of the confidence comes when you see results. And as I mentioned, when you do specialize, it's easier to get results because you have a better grasp of what you're dealing with and the strategies that you can offer. Obviously, for a beginner, it's hard to decide. I can give myself as an example. I started because of circumstance by sport medicine. Now, sport medicine, from Chinese perspective, at the time I didn't even know this, is a external medicine, which basically involves sinew channels and defensive energy, Wei Qi, and the treatments are simple treatments because the pathology is basically a traumatic pathology from outside. The subjects that I was treating were all young and healthy people. So the results were fabulous. And it was very encouraging that when you start, you don't know what works, and you put a few needles, pains disappear, and bruises resolve very quickly, and people are capable of going back and doing whatever they were doing. Now, later, I said, okay, now that this is so successful and people had complaints, I said, I'll take on headaches. Now, at the time, I didn't know that the headaches is one of the most complex areas in Chinese medicine. And that's when I started having my challenges and realizing that I need much more experience and knowledge to handle this. So basically, it is good to start with simpler things. And I find that sometimes it's good during the study period to find out also what are simpler things that we can do for which we get easily results. This gives self-confidence. And from there, of course, we get more and more confident. It's a very important element that we believe in what we are doing. Actually, one of the teachings of Sun Miao to his students is exactly that. You have to believe in what you're doing. And then your belief brings automatically a confidence. I prefer to do very few points, but the points I'm doing, I know what they're doing and I know where they are, rather than taking a recipe and sort of putting out 20 needles. There is one of the French acupuncturists of the previous generation, Lavier, he had given an equation which I find very interesting. It was saying that if the therapist, the practitioner, believes in what they're doing and the patient believes in what they're doing, they have the best results. If the practitioner believes but the patient doesn't believe, the results are halved. And if both don't believe in what they're doing, there is no result. Now, we can speak about placebo, nocebo, etc., but we know today that the placebo effect is fundamental in therapy. And when the both practitioner and patient believe in their action, obviously the results are better, and this further gives the confidence to the practitioner.
That's wonderful. Thank you, Hamid. Now, we've discussed starting out in practice. However, watching this, there will be many practitioners who've been in practice for many years and are beginning to feel exhausted and burnt out. Do you have any advice about how these people can keep things fresh?
Um, as I mentioned before, I have never felt bored or burned out because my practice has always evolved. I've always been learning and adapting and bringing new concepts into my practices and looking sort of at the person differently. If we do symptomatic acupuncture, doing the same points on everyone, automatically at some point we're going to be very disillusioned, maybe even burned out by the practice. But if each case, each person that we see is a challenge to our sort of concepts, a challenge to our understanding, we try to go deeper, we try to reach the person at a deeper level. I don't believe that this can happen, the burnout can happen.
Now, finally, where do you see our profession, the future of our profession? Let's look ahead in 20 years from now.
Well, I have always dreamt of a better world in which the different medicines can collaborate and work together. I have seen the positive results where we had sort of therapy centers grouping allopathic medicine, acupuncture, homeopathy, and osteopathy. And I have found great results. And I really believe that medicine has we could say three distinct spheres. There is the allopathic chemical and anatomical medicine, which is very well dealt with Western medicine. And then there is the energetic medicines, what we call vibrational medicines, which include acupuncture, homeopathy, and other vibrational medicines. And they create also a sphere of action. And then the third category are the mechanical medicines. This is osteopathy, chiropractic, and sort of techniques which are dealing with the skeleton and the equilibrium of the musculoskeletal equilibrium. Now, each of them, each of these medicines has its area of specialty and also efficiency, but they overlap. So some areas you can use one or the other. And in some areas, you can use any of the medicines. For example, a simple thing, a stiff neck, you can treat it possibly by giving anti-inflammatories, you can treat it by putting needles, or you can treat it by doing the osteopathic manipulation. But some areas are very specialized. And I find that each of the spheres of action has its limits. And we cannot expect that one method is going to respond to all people's diseases and problems. When you break a leg, obviously, you go to the hospital, to the surgeon. You don't go to the acupuncturist or the osteopath, and so on. So we have to create clear limits of what each medicine can do. And in some areas, associating them can be very beneficial. I have, in my practice, I have hundreds of examples where, for example, pathology was treated by allopathic medicine for months and months without results because the problem was a mechanical problem. A vertebrae was out, and if you don't put it back, the problem goes on. Or it was an energetic problem. So in I would say, a sort of holistic medical approach, we will have combination of these, And it will not be like separation between MDs in the hospital and non-MDs doing what they call complementary medicine. It should not be sort of alternative, it should be complementary. So my hope for a better future would be to sort of combine all of these methods and bring them and propose them to the public. And one of the things which I actually am missing a lot is that when we study Western medicine in medical school, we are never told about the other approaches. The other approaches are sort of considered quack medicine. And it's a pity because research today, if you go on the internet, the metadata research demonstrates the efficiency and the results that other medicines have. And you can always argue that they're non-scientific, and yet they work. So if they work, we have to integrate them. And that will be some hope also that in Western medical schools, we also offer some information, doesn't have to be much, but 1 or 2 days of information. Even diet, which is a fundamental part of life and of prevention of disease. In Western medical schools, we have a few hours of education on diet. What to say about energetic medicine. So this is my hope for the future.
Hamid Montakab, thank you so much. What an absolute pleasure. Thank you.